Good morning, good afternoon, good evening, good night. Hello to everybody, wherever you may be in the world, and welcome to the first session of the day at the Top 100 Podinar series. Just a quick reminder that if you'd like to get your 1 hour credit, AGD or PACE credit at the end of the session, there's going to be a link in the comments section. That's a link in the comments section. And you can go through there and get your credit for participating in today's program. Also, don't forget to put in your nominations for the top 100 for the year for pharmacy and medicine and some of the other categories that we have. Choose people who deserve to be in this realm and honored with the top 100, and then just steer them to the nomination page and go from there. Everything follows from there. Today, we have a very exciting presenter, Dr. Michael Glogauer. He has been offering patient-focused periodontal care for more than a quarter of a century. The one-to-one interactions that he has with patients highlights his practice. And he's very passionate about delivering care that changes lives. Now, Michael Glogauer received his doctorate and his PhD at the University of Toronto and did postdoctoral training at Harvard Medical School and Brigham and Women's Hospital in Boston, Massachusetts. In addition to his very active current practice, Michael is a professor at the University of Toronto, dentist-in-chief at the University Health Network, dentist-in-chief of dental oncology and maxillofacial prosthetics at the Princess Margaret Cancer Centre in Toronto, and scientific director at the Centre for Advanced Dental Research and Care at Mount Sinai Hospital. He lectures extensively internationally as well as throughout Canada, and has published more than 200 peer-reviewed articles and holds 2 patents on topics related to oral and dental health. His articles have been published in the Journal of Biomedical Material Research, Journal of Periodontology, Psychosomatic Medicine, and Methods in Molecular Biology, and Oral Health in Canada, just to name a few. Now, without further ado, I'd like to begin talking to Michael. With that introduction, you're obviously the expert in this field, and I'd like you to just briefly encapsulate what you're going to be discussing today in your presentation.
Sure, George, thank you for the invitation. So my talk today is really going to focus on this very exciting new product. For more than a year plus now, almost 2 years, we've been working actively to try to develop something that will deal with the SARS-CoV-2 virus amongst other respiratory viruses in the oral health setting. And one of the major issues, as we know, as I will discuss today, is that this virus plays a significant, one of the major portals of entry for this virus is the oral cavity through the saliva glands as a site of infection as well. And so with that being understood now, we can recognize that perhaps dealing with the virus within the oral cavity may be of significant benefit towards preventing some of the respiratory infections, including COVID-19. So
what you're actually saying is that if you can literally head off these problems of the past, the point of entry, which is the oral cavity or the nasal cavity, then you can prevent the more serious situations that develop as we see with COVID-19.
Right, exactly, because we know the virus has to gain access into the respiratory tract, and the mouth and the nose are not only obvious, but have been demonstrated now to be the portals of entry that we need to control.
And these are obviously external access, so they're easy to access for the patient on their own. It doesn't involve any surgical, any I'll ask you later, or perhaps you'll describe whether this stuff is medical, it's prescription, can be applied by the patient or the individual themselves, how it's available. So we'll discuss all of that. Now, COVID-19 obviously is the main topic nowadays, but there are a lot of other respiratory tract infections. And how does this therapy relate to that?
Right. So I think, we're always chasing, I think it's great everybody in all these companies and the science is chasing the SARS-CoV-2 and COVID-19. But the beauty of what we're going to discuss here is that not only does it deal with that, but it deals with the larger issue of respiratory infections, which are a constant burden on society. Every year, in fact, as many people die from respiratory infections as a global number as have died from COVID-19 in certainly North America. So I think that, we want to make sure that we keep everything in perspective and that we make sure that we're not just chasing sort of the current issue, but we look at respiratory viruses as a global health problem. And that so therefore you want modalities of therapy and prevention, because this is a preventive, this is not a treatment modality. This is a preventive modality that it can deal with this virus and the constant sort of threat from most of the respiratory viruses that we deal with. And so that's what I'm going to be discussing today.
Okay, so you mean to tell me that at some point in the future, I can look forward to going through a whole winter without a flu, without any respiratory infection whatsoever, and not have that 2 or 4 weeks of downtime that I've enjoyed every year for the past 40, 50 years?
Right. Well, so I mean, and you bring up a good point, because I'm sure people have sort of seen this, but sort of the influenza virus, the major flus that have sort of hit us every single winter since we can remember, have actually not shown up on our shores this year. And maybe that's due to some of the issues with the preventive measures we've used to prevent COVID-19, or maybe we're not going to spend too much time as to why that is. But I think that it's clear we can prevent influenza. And the question is, how do we do that? And then we believe that this modality may help in that regard.
Now, for the past number of years, I've been getting so-called flu vaccines every fall. Mm-hmm. And they're targeted to 2 or 3 strains that are likely to be prevalent that year. Mm-hmm. Some years it's worked and I haven't had a problem, and some years it hasn't worked and I've had a flu. But that is a little bit different. So you're saying that this approach is more general and tends to protect against the whole broader range of influenza or respiratory issues.
Right.
Am I correct in saying that, or?
Yeah, I think that by the end of this presentation, I think it'll be clear that what are the benefits of this topical agent, and that it actually, as I'll discuss, there's some synergistic. There's a synergistic effect between 2 of the major ingredients. One, that there's actually sort of an innate immune activating role, but also a topical sort of targeting of viruses. The reason this works against so many viruses is that it acts on the surface structures of the protective coat that protect viruses, as opposed to being primarily sort of an immune type protection that you'd get from a vaccination. So this is sort of like a topical antiseptic with a little bit of immunomodulatory, at least in terms of the oral innate immune system. So I look forward to sharing that with everybody.
Well, that's a perfect segue into your presentation. So without further ado, thanks for giving us a summary, and I can hardly wait to hear the rest. Please go ahead.
Perfect. Do you see my screen?
Yes, I do.
Perfect. Okay, so again, the title of this talk is Innovative Oral and Nasal Biotechnologies, Breaking the Chain of Viral Respiratory Infection. Georgia has already given sort of my my bio, so I'll skip that. Again, this is This is a product from Oral Sciences International, which is a company dedicated to developing and commercializing innovative oral and nasal biotechnologies and devices. And our mission is to actively identify and bring to market safe and efficacious therapeutics, treatments, and technologies to diagnose, treat, and protect society against viral and bacterial illnesses. So, as we know, COVID has permanently changed almost all aspects of our society. Coughing and fever are no longer socially acceptable. There's a generalized heightened awareness of sort of the microbiome, the aerosols that we have to deal with on a daily basis. And we know that because PPE has become the norm. Masking now, I don't know about you, but when I go outside without a mask now, I sort of feel naked. All age groups are affected by virus, especially with the variants that are starting to wash up on our shores. And health systems have been proven inadequate to a large extent. I don't know what it's like in most other places, but I sort of feel like many of the measures taken are sometimes to really do everything we can to protect our healthcare systems, which are certainly struggling under the current threat. So there's an enormous global impact of disease, especially respiratory diseases. So for example, in Europe, annual pneumonia costs have been estimated to cost 10.1 billion euros. Has been a significant global economic loss due to the first SARS outbreak in 2003, which was a much more minor in terms of the effect on society. That cost $40 billion. So we know that what we're dealing with now is going to cost a lot more than that. U.S. annual medical costs have sort of been about 10.4 billion. Those losses due to illness and loss of life. And the United Nations reports global impact of this coronavirus caused the economy to shrink by 4.3%. So these are significant economic costs, never mind sort of the health and people costs. So let's sort of give it some overview of the respiratory route to infection. So there's over 200 virus strains that are often spread by aerosols, such as sneezing. They remain airborne for a significant period of time, and they enter the respiratory tract through the nose and the mouth. There's thousands of replications that can occur within a very short period of time. Once the virus attaches to the mucosal surface, the virus is then obviously internalized into the cells. They reproduce, those cells burst, release the virus. So it's a very rapid and multiplicative process where you get very high viral loads in very short periods of time. And so the question is, how do you break that chain? How do you prevent these respiratory infections that are caused by the human coronavirus, the influenza virus, and the rhinovirus, which are sort of the top three families that we have to sort of deal with? So there are a number of strategies that are evolving, whether it's sort of sick care. So we use over-the-counter drugs and antivirals. They have high cost drug resistance, and you can recognize some of the usual names that have been. This is a multi-billion-dollar industry in terms of treating the symptoms. Daily habits now have also sort of become a significant entree into the field. That includes vitamins, antioxidants, nasal washes, home therapies. But I think there's a trend now towards health care and preventive care, whether it's mask, hand washing, washing surfaces, staying 2 meters apart, PPE, mouth rinses. So there's this push towards health care as opposed to sick care. And, during our daily journeys, whether it's waking up, having breakfast, all the things we do throughout the day, each one of these is a risk event as we're contacting with people outside our homes, surfaces outside our homes. Each one of these is a risk event that if we can somehow modify or modulate that, get some sort of protective element in there, we can dramatically reduce our risk of sort of contracting one of these respiratory viruses. So, something to think about from a poll standpoint, is it acceptable to go to work with a runny nose or a sore throat? And when we run these polls previously, we can get the majority of people, well over 90% when we run these polls, show that it's not acceptable to go to work with a sore throat, a cough, or a runny nose. So people are starting to recognize that this is an issue. So there's a lot of evidence now that suggests the mouth may be one of the primary routes for the SARS-CoV-2 virus. And in a series of studies that have come out of the NIH and other labs in the United States, it's been shown that number one, the salivary glands of interest have high expression of the ACE2 receptor, which is what the SARS-CoV-2 virus uses to attached to cells. And more than that, they've shown that there's a significant infection risk of these salivary glands. And so there's this constant production in people who are infected of virus being released through the salivary glands into the mouth. And those can certainly, once they're in the mouth, can be inhaled, brought into the respiratory tract, or can certainly also be at risk of being aerosolized to cause infection in others. So the idea is if we can control the viral load within the mouth and the nasal cavity, that can protect both the host and those around the host. So we need to sort of break that chain of infection by doing everything we can to deal with the oral and nasal load. So now I'm going to talk about some of the studies that we've carried out that form the underlying base science core for this product. So the product in the US is called Flavobac or HealthGuard Complete. In Europe, it's called Cold and Flu Guard. In Canada, it's called Cold and Flu Guard Gold. So this is non-GMO, non-prescription. It's largely made up of natural active ingredients. And in the United States, it's for 2 years up. And in Canada and the EU, it's for 5 years up. So the ingredients are a high molecular weight hyaluronic acid, which is a naturally occurring polymer. The key killing agent is something called Flavobac, which is a patented plant-based specific complex of bioflavonoids. Again, it's got glycerol, menthol, and echinacea as the other three ingredients rounding out this new product. So let's talk about the high molecular weight hyaluronic acid. So it increases the viscosity of the agent, ensuring efficient application to the mouth and throat. It forms a barrier to trap incoming pathogens. It's a lubricant and also forms this film to help keep the Flavobac, which is the active ingredient, on the surface of the mucosa. And one of the important things that it's been shown for hyaluronic acid, it actually can help activate white blood cells called neutrophils in the area to help them more easily, or help enhance their killing of bacteria and viruses in the area. So it serves dual purposes, and it works synergistically with the Flavobac or the bioflavonoid molecules, which have been shown to carry out anti-pathogenic activity. As we'll go through, it's very effective in terms of killing various respiratory viruses, in addition to bacteria, which we'll talk about in a few minutes. Its sort of active process it acts as an antioxidant and has free radical scavenging activity. So it has an effect not only to be able to interact with enzymes on the surface of various microbes, but it also helps dampen out of control innate inflammatory responses. And as we'll show, it's effective against a variety of viral strains. So let's just quickly go through some of the studies. So in a series of studies at the laboratory microbiological level, shown that the Flavobac can kill SARS-CoV-2, H3N2, H5N1, influenza, some of almost all coronaviruses and rhinoviruses. So it's very effective in killing some of the key respiratory viruses that we have to deal with. Again, in a study done in Europe, it was shown that it's quite effective against SARS-CoV-2, much like the studies which were done in the States and Canada. So again, just a series of studies shown that in very short periods of time, in minutes, the Cold and Flu Guard is able to dramatically kill viruses. So in some studies that were done in my lab, again, we wanted to carry out some efficacy, not only efficacy, but some safety studies. So we focused on the oral microbiome just to get everyone up to speed. So we know the microbiome is the aggregate of all the bacteria, the microbes that hide on all the surfaces of the body. As you may or may not know, that for every one cell in the entire body, there are 10 microbes present within or on the body. So that's quite significant. And it's critically important that whatever therapies we use do not disrupt that, because those microbes are essential for human health. Within the oral microbiome, there are about 700 species that make up a healthy oral microbiome, and we want to make sure that we don't perturb those. One of the ways we do that, again, this was done in my lab, we're able to catalog and characterize all the species, all the bacteria that are present within the oral microbiome by collecting an oral saliva sample, a swab. We can then catalog all the species present by something called sort of next generation sequencing of the 16S ribosomal RNA present in that sample. And so we're getting a complete cataloging of what bacteria are present. So during a study that we carried out for safety and efficacy, we took healthy people, we got their baseline microbiome, we had them use the spray 4 times a day, and we looked at the microbiome present at day 3 and day 7 to see, does this perturb the microbiome that's present? And to go through this sort of complex side, but to give you the take-home message, the answer is that the commensals or the healthy bacteria actually remain exactly at the same level. Interestingly, that like 2 or 3 of the pathogens that are present in the mouth actually were the only ones that were reduced, which is sort of an added side benefit. So this is just a little bit higher resolution showing that. So for example, one of the major commensals, Streptococcus salivarius, did not change as you go from red to green to blue, which is the day 3 to day 7, using various approaches that included, for some of the lactobacilli, other streptococci. But is that when we looked at some of the known oral pathogens, example Porphyromonas, you can see from sort of moderately high levels to almost undetectable as we went through days. And that's true for Peptostreptococci stomatitis, which has been shown to be a pathogen. So the take-home message is that the cold and flu guard did not alter the indigenous oral microbiota of the oral cavity. There were some disturbances actually only in the pathogens. So largely this is safe to use. It does not appear to upset or perturb the normal healthy oral microbiome. So the way this is delivered is through an oral spray, which is an excellent way to disperse or evenly distribute it throughout the mouth. It sprays and targets the mucosal or the epithelial and teeth lining surfaces. The manufacturing allows us to make the oral spray sterile until usage, and it's stable at room temperature and easy to transport. Again, we're able to sort of target the 200 up to 200 viral viruses that have been shown to cause a significant issue in terms of the respiratory tract. And they're able to do it very quickly. So you spray the hyaluronic acid, as I mentioned, and the glycerin form a mucosal barrier. The viruses become trapped on that surface. They cannot infect mucosal cells, but in addition, while they're on those surfaces, they're killed by the flavobac, which destroys the envelope viruses, as I mentioned. It's not an immune response necessarily. It's destroying the protective coat. And we are able to achieve a goal to protect and prevent infection, both to the patient, both to the subject using it and to those around them due to the reduction in aerosols that could be developed. Okay, so where does it fit in terms of your everyday life? So there are multiple opportunities for daytime protection against the virus, whether it's before your office, whether it's before consulting patients, again, using it after lunch, again, when you're back in, you're performing surgical procedures, or there's an opportunity to, when you're interacting with those you can use this multiple times a day to sort of protect you. And so the product is portable and is easily carried in your purse, backpack, or even your pocket. And you can use it again whenever you are walking around and coming into contact with people. There's an opportunity to spray this excellent product. So in the United States, the recommended sort of dispensing and use are shake well before its use. You spray 4 times to the affected area in the mouth, gargle and swish it around, try to keep it in place for 1 minute, then spit it out, and use up to 4 times daily or as directed by your doctor and dentist. In the EU, it's a little bit different because you actually can spray it into the nostril as well. It was tested that way as well. And you can then repeat 1 to 2 sprays in the mouth and again, use it 2 to 3 times per day. Again, this is for ages 5 and older. I would say that really the only contraindications are hypersensitivity or allergy to any of the components. There is a note put that if you're pregnant, consult with your doctor. And again, the product can be stored in a cool, dry place with a maximum temperature of about 25 degrees. So again, the bottles are small, 50 ml, so it's very easy to carry around in a sort of a portable manner. So again, when we've given this presentation and sample, yes, we get a very, very high yes rate on the answer. Would you use cold and flu guard or Flavabac Health Guard to protect yourself? And the majority of people would also recommend this for their patients or their colleagues. So I think that is sort of the discussion. I think we're now really open for questions and happy to discuss how the benefits of this product and how it can be used quite openly in society. George, you're on mute still, sir.
Okay.
Perfect.
Now I'm back in. Fascinating stuff. Am I correct in understanding that if I spray this, I'm protecting myself and the people around me from COVID-19, as well as a whole bunch of other things?
Right. So I want to be, as a scientist, I want to be 100% clear what we've tested. So this is being tested in vitro, and it's to kill the virus and all those viruses, and it does a very effective job in doing that. And so from that, we're making the logical next step at this. If it's working as a topical antiseptic and it's to kill the virus, preventing it from sort of living and staying on these surfaces, that biologically that should be able to prevent aerosolization, because you're decreasing the viral load. Everything we can do that's been the whole approach from a public health standpoint, is to do everything to prevent aerosolization and propagation of the virus. So masks work, that's why we're all wearing masks. So if we can go one step further and kill everything on the inside, sort of on the inside of that mask, that just makes, that's just taking it to the next level and doing everything we can. Eventually, I'm assuming that eventually we'll stop wearing masks, but I think, anything we can do to help prevent the liberation of those viruses into our lungs and out into on the other side of that mask will go a long way from a public health standpoint in terms of protecting society.
All right. If I'm practicing dentist, which I am, and I want to protect myself and my staff to the full extent, I'm working a typical day, morning and afternoon. What's the best way of applying this product?
Right. So in my office, because I'm also a practicing dentist, in my office, what we do is we're having our staff rinse, spray as indicated in the instructions. First thing in the morning, before we start seeing patients, after the coffee break, after lunch, and after the afternoon break. So we're using it probably every 3 hours or so as a means towards decreasing risk to our staff, and also to do everything we can to minimize the risk to our patients. And then I would say, from that also is that, I will use it at the end of the day, when I'm going out to a store, whenever I'm coming into contact with people, I'm using it to do everything I can to minimize my infection risk.
If you're carrying one of these bottles in your car, and your temperatures that are extremely cold or extremely hot, do you know if the material is affected? It's degraded at all?
Right. So I personally keep it on my person in my pocket. So we
Good
know
idea.
we know that it's safe up to 25 degrees Celsius, which is a little higher than body temperature. So, as long as if you're keeping in that area, we know that it'll remain effective and will remain stable.
And how long will it last? If I get a bottle, how long can I expect it to last?
So a great question. Well, you see, I'm using a bottle, and I'm going through maybe a bottle every month or so. And so we know that the shelf life is much longer So really, it's that that length of time shouldn't be an issue.
So if the bottle is expiring before you finish using it, you're not using it enough.
Exactly. Exactly.
That's one way to look at it. And I'm coming back to something that I said before. This is now the attention with COVID. This is really targeted at that concern. But what you were showing was that this is very active against a whole range of respiratory infections or conditions.
Right. Exactly. I would argue that that's where the bulk of the benefit comes in. We're going to be, hopefully most of us, if not all of us, will be vaccinated soon. It looks like the vaccine works pretty well, even against most of the variants that are coming up. But this will be around, should be around for as long as we have to deal with viruses, because the major advantage into our very, very equally effective against almost every single respiratory virus we can think of. And we know respiratory viruses have been the bane of our existence for centuries. All these pandemics, for the most part, are viruses that make their way down through the mouth and nose into the respiratory tract. That is the mode of entry. And so anything that we can do to sort of prevent that, it would be a huge benefit. And we really feel like this is one of the key go-to protective agents that we can use.
If you can head off the infection before it starts or minimize it,
right?
Obviously,
right.
That's the case.
Right. And what you're doing is, by preventing or helping to eliminate from a salivary gland infection, which is the major sort of nidus or source of the virus within the mouth, we can go a long way towards preventing your own infection and those around you.
Now, I know you mentioned this, but I'd like to reiterate it. Are there any groups or classes of patient or public that shouldn't be using this?
Yeah, so because it's essentially been shown to be very sort of very safe to use. I mean, when something is allowed to be used in 2-year-olds and 5-year-olds, you know that it's a very, very sort of has a very sort of narrow spectrum in terms of really focusing in on the oral microbiome, which we've shown it to be safe against, certainly the healthy aspects, and has a very sort of, it really is able to attack the protective coat on the virus, which again, it really sort of spares human cells. It doesn't target membranes on human cells in any negative way. And as I mentioned before, it's actually an antioxidant. So most of us health conscious people are taking antioxidants regularly as a means to sort of limit inflammatory responses, et cetera. This is a product that just falls directly into that line. And to be clear, this is a product, the Flavobac is isolated from a specific Spanish orange. So in other words, this is a citrus fruit product. And is extremely safe.
Now, let's say one of my patients sprays this into his mouth and swallows some of it. Any risk?
While swallowing is not recommended, again, it would be the equivalent of taking an antioxidant pill that many of us will take to help as a preventive measure. So it hasn't certainly been tested that way for just because testing systemic, something that is much more expensive and labor intensive, we haven't done. But again, the major benefit I would say is topically, but I would say that there's no concern and it would not have been approved if there was concern along those lines.
I think you mentioned 2 or 3 academic settings where the Flavobac and its effectiveness was tested. Right. Where were they? Which countries were they? Which institutions?
Sure. So the key microbiology labs that have been used, there was one in the UK. I cannot remember the actual location of that. And the second one was a very prominent microbiological testing lab at the University of Utah.
That's in the Utah, United States, right?
In the United States, exactly. And then obviously the biofilm testing was done at Toronto.
Now, you had mentioned something to me about the biofilm testing of this product and how it was effective against certain
Paranormal.
populations of virus and bacteria and not
Yeah.
effective against others. I wonder if you can just reiterate that.
Sure. So, I think previously, actually, the flavobac has been shown to potentially be of significant benefit in the sort of the periodontal disease, periodontal treatment modality sort of realm, which is why the results that we showed against P. gingivalis and T. forsythia are not surprising. So others have previously shown, their studies have shown that it may actually be able to specifically target some of the key periodontal pathogens that we have to deal with on a basis within oral health sort of dental setting. So that's not surprising, but it's nice to see it sort of recapitulated in a study that was more focused on the sort of on the commensal, the not perturbing the oral microbiome. So while not surprising, it's nice to see that confirmed that it also has a benefit in sort of the oral health maintenance side of things.
So what you're saying is that, I mean, we look at certain drugs, certain antibiotics, and they're broad spectrum and they wipe out everything. So when you're having certain antibiotics, you're told to eat yogurt because it affects the gut flora and so on and so forth. So what these studies show is that in the oral cavity, in the nasal cavity, the bad agents are affected and the good commensal agents are not. Am I correct in saying that?
I think that's exactly the message we have learned from those studies. So I think that at least sort of on a 7-day period, there was absolutely no change in all the commensals and the overall makeup. There was no change in something called the alpha and beta diversity of the microbiome, which are other measures which I didn't get into that really show that there's no change on the complexity and the diversity within the microbiome through this product.
So that portends well for continued use, long-term use, regular use throughout, let's say, a whole flu season, winter season,
right,
without any damage to the overall ecology of your system.
Exactly. And that's critically important because I think one of our concerns in healthcare is that many of the health promoting and therapeutics that we use always have a potential for a downside for unforeseen or unexpected consequences. And in sort of the antiseptic antibiotic world, we, as you've mentioned, antibiotics and the routine use of antibiotics can often create significant problems in patients. And some patients are more susceptible to those problems than others. In fact, many of the sort of inflammatory bowel disease, gastrointestinal issues can often be associated with prolonged use of antibiotics. I mean, a really interesting study, a group of studies have come out showing that, for example, in the cancer cell, immunotherapy, which is next modality up, which is really in the lives of many cancer patients, has been shown to not be effective in some. So one study that showed in patients who had antibiotics within 2 or 3 months of immunotherapy, the immunotherapy was much less effective in killing the tumor cells. And that's because we know that the microbiome is critically important for maintaining health. But apparently it's also critically important for keeping the immune system trained so that it can be activated through immunotherapy to kill tumors, for example. So in my practice, I do everything I can to minimize the risk of disrupting the microbiome. And that's why I'm so enthusiastic about this product, because we were able, and that's why we tested in my lab this way. I wanted to make sure that it, at first, our oath is to at first make sure we do no harm. And so I wanted to make sure that this product did not damage the microbiome, which we all know to be critically important for the maintenance of health.
In your presentation, you mentioned rinses and sprays. Is there any difference between these two?
Right.
And why are there two animals in the field rather than just one?
Right. So the constituents are the same, the delivery mechanism. I would say that, I think it may have to do with the nature of the markets. I think the other thing also to remember is that the advantage of this, it's a lot harder to carry around a rinse in your pocket. It's carrying out a 1 liter bottle versus a 50 ml spray. So from a cost-effective standpoint, from a practicality standpoint, there's certainly great benefits to being able to use a spray. But the the components are the same.
So it's basically just a local marketing and regulatory issue, but otherwise it's the same.
That's my answer, but those decisions are above my pay grade.
Okay. Now, you also showed a slide of the 3 different products, and they had different names, and you said they were available in different areas. Why?
Again, I believe that has to do, getting something approved in Europe versus getting it approved in Canada versus getting it approved at the FDA level in the United States. They've all got slightly different hoops and requirements, and that's why these end up being also they get introduced first in different places, and so that sort of impacts on the nature of the product as that gets developed.
Okay. And you mentioned that Flavobac is from citrus fruit. Obviously, this is a natural product, and I guess everybody tolerates it quite well.
Yeah, I mean, I think that, again, it's nice to be able to use things that are in nature. I just want to, I mean, I think, we want to be responsible. We recognize there are a lot of things in nature that are very bad for you. But this is, but having said that, I think that there's value. I mean, one of the reasons why the health benefits of citrus fruits, one of them is that the antioxidants that are present within those citrus fruits have great health benefits. And so what we've done is we've captured one of these key health promoting elements within citrus fruits, and we're now using it at a higher level in a topical setting to help produce and maintain health. And so, I think we can use, instead of sort of going through and trying to develop new drugs, which is certainly a valid approach, but, I would say using what God has given us allows us to get to market faster, and we're just basically using what is naturally helpful in the healthcare setting.
I like that approach. Now, if I'm interested in more, actually accessing some of the studies on the product, if I'm actually interested in getting the product, how do I go about that?
Right. So I think, absolutely you can contact myself through my email address. I think if you put my name into Google, if you put your name into, if you put Oral Science International into a Google browser, order information and contact information will pop up immediately. That's the beauty of that's one of the beauties of the world we live in when it comes to the internet. And you'll be able to contact us by email. There's contact information. Our CEO is Christian Sauvageau, and he is very accommodating. We'll get back to you immediately with information on how you can order it in your locale.
Yeah, I've just tried it as we were speaking, and if I go to oralscience.com, that's where I can access it. Oralscienceinternational.com also gives me looking at oralscience.com, and Oral Science International doesn't. So that's where it's a good place to look. All right.
I know that our All Science International website is very close to being completed. So it may not work today, but very soon it will.
Okay. Well, for now, Oral Science, without the international, even though it is international, will still work. Oralscience.com. Keonor, do you have any questions?
Actually, Doc, let me join you guys again. I'm just sitting back and observing and listening to this wonderful presentation by Dr. Michael. It's very exciting stuff and much needed of a product in very troubling times. In fact, I put the URL for our colleagues into the chat box on the side. Right above your CE registration, you will be able to go up there and inquire more about the research and the products from Dr. Michael. Quite impressive. What was it like to get through regulatory with this thing? Did it take you a long time?
I think considering the hoops and hurdles that you need to jump through on these things, I think it's come through pretty nicely. It definitely here, right? I mean, we very early sort of do the science. The science took I feel like the science was half the time and the regulatory half of the time. So the other major advantage is that as this product that was good for SARS-CoV-2, I don't know how I would be excited, but not as excited that it's just generally a viral. It has general virucidal properties. We're going to be able to really improve things long term through the controlling of respiratory virus cycle.
Excellent.
Now, as we were talking, as you were asking your question, Kianor, I looked it up, and there is a direct website to Oral Science International, but it's not called Oral Science International for now, just for fun, just to make life a little bit complicated. It's called coldandfluguard.com. That's cold and flu, COLDANDFLU, guard, GUARD.com. All one word, coldandfluguard.com.
I put that URL, friends and colleagues, also in the chat box, and we recommend that you take a look at it. There's great information on there. Dr. Friedman, you alluded to the international scenario, and Dr. Michael, a vast majority of our audience is scattered all over the world. Is this something that they can order from any location, or how does that work?
Yeah, so I think the answer is, I believe that you should be able to get it from off that website. I know that the company will make every effort to help get that out to you.
Fantastic, fantastic.
And I've put the addresses on the chat side.
Excellent. I think our colleagues will find a tremendous amount of applications in their personal and clinical lives with this product. So, gentlemen, since we are clinicians that work precisely within our guidelines, we're coming up to the close of the podium. Other questions that our colleagues may post, they will be in the chat box, and I would appreciate Dr. Michael, if you can respond to them and get back to them with any inquiries that come about.
Perfect.
Michael, thank you very much. Great big thanks from all of us on the Podinar to Dr. Michael Glogauer, one of the main researchers on this area, and a tremendously gifted and published and lectured individual. Thank you for your time. Thank you for your effort.
Great. Thank you to both of you for the invitation.
Thank you, gentlemen. Have a wonderful weekend. And just as a quick last note between Dr. George and Dr. Michael, I think there's a couple of hundreds of research publications and pieces out there that are the leaders in the research and publication space, actually, in the profession of dentistry. Dr. Friedman is one of the top contributors to dentistry today, so you can also follow his work. He's been doing product evaluations for over 3 decades. Gentlemen, we really appreciate your contribution. Thank you.
Thank you.